State of the Union with John King, CNN Sunday, 9 a.m. to 1 p.m. Eastern.
We've also said that the bill has to be deficit neutral. The president yesterday said he will not sign a bill that isn't deficit neutral. To get there, some additional revenue in the short term is necessary. The House has one approach. We put forward a different approach. The Senate is considering yet more options. The key thing is we need to get there in a way that is deficit neutral.
But you say the president has a plan, the House has a plan, the Senate has a plan. There are many, as you know, saying it's time for the president to settle this squabbling within the Democratic Party, that he needs to step forward and lead, that the risk is, if he doesn't do it now, that this whole thing could go off the cliff.
Well, look, this is the legislative process, and this is what normally happens. I think we are making good progress. You had the Senate Help Committee actually report out a bill. Next week, the Energy and Commerce Committee in the House will be marking up a bill, and the Senate Finance Committee is in intense discussions to move forward too. So there's been a lot of progress here.
A lot of progress, but not a lot of consensus yet on how to pay for it, which is the big problem. I want you to listen to the Democratic chairman of the Senate Finance Committee. He wants to pay for a lot of this. Yes, like the House bill, squeeze some savings out, but when you need the extra revenue, Senator Max Baucus, the chairman, would like to get that by taxing health care benefits that many Americans get from their employers. The president doesn't like that idea. Max Baucus says this.
Basically, the president is not helping us. He does not want the exclusion. That's making it difficult.
You disagree with him policy-wise, but to have a Democratic chairman say the president is not helping us, they are almost begging for more intervention from the president in the Senate.
Well, there has been a lot of discussion with the Senate Finance Committee. That particular proposal is one that the president doesn't favor, but we've put on the table lots of other proposals, and we are working closely with the Senate Finance Committee to get to where we need to be. Remember, none of this is easy. There's a reason why this hasn't happened in 50 years, and we're making a lot of progress.
The House bill, which has that surtax and the savings, the Congressional Budget Office, which you were once the leader of that office, says that it would not be deficit neutral, as the president has insisted again in the past 24 hours. It says it would add $240 billion to the deficit over 10 years.
Only because it is keeping current Medicare reimbursement rates for doctors, which was always baked into the cake. Everyone anticipates that even absent healthcare reform, that would be taken care of. If you take that off the table in terms of new policy, the House bill is deficit neutral.
You want to leave the legislative process to run its course. So let me ask you, take off your budget director hat and talk to me as someone who understands the economy with your academic training. When it comes to the overall economy, what would hurt the economy less? The House proposal, the surtax on upper-income Americans, or taking away the exclusion and ending up taxing healthcare benefits? In terms of the impact on the rest of the economy, does it make a difference?
Well, they'd have different effects. I mean, to raise the same amount of revenue, the exclusion would be affecting more people. So again, this isn't a simple yes/no kind of answer.
It's affecting more people, good or bad? Is it spreading the pain, or is it causing more pain?
Again, it depends what your objective is. So look. The key thing here is we do need to make sure that this, first, we need to get this done because it hasn't been done in 50 years. The current system is unsustainable. We can't go on with not only such rapidly rising costs, but individuals facing constraints on pre-existing conditions and difficulty obtaining insurance and what have you. We need to get it done. It needs to be deficit neutral. And in the short run, some additional revenue is going to be required.
Some additional revenue going to be required. I want you to listen to the man who holds the job that you once held, because he looked at the leading House plan and the Help Committee plan you mentioned that is passed in the Senate. And you have been adamant from day one, as the president has been, that the goal here is not just the moral imperative of helping the uninsured, but the policy imperative, the financial imperative of stopping a government health care costs that keep going up like that and at least getting them here. Listen to Doug Elmendorf.
In the legislation that has been reported, we do not see the sort of fundamental changes that would be necessary to reduce the trajectory of federal health spending by a significant amount. And on the contrary, the legislation significantly expands the federal responsibility for health care costs.
So this doesn't do what you need it to do, the proposals as they now stand. You know him well. You had that job. Do you take issue with that, or is he right?
Well, let's actually look at what the Congressional Budget Office put out on Friday night with regard to the House bill. And again, taking the doctor payments off the table, that bill is deficit neutral over 10 years. There are out-year deficits that we want to bring down even further. I think the single most important thing that's missing from the legislation at this point is our proposal for an independent commission of doctors to help the policymaking process be more flexible, lead to higher quality and lower costs over time.
Why
that
isn't
is
that
a big game changer. Well, I think ultimately it will be. I sent up a letter on Friday to the leadership of both the House and Senate laying out, including legislative text. It's the first time we've sent up specific legislative text, laying out a proposal to do that. We think it's really important.
The president, in his weekly address, talked about special interests. He said special interests are trying to knock this off the track. As you know, Republicans say one of the reasons you're having a hard time paying for this is because you won't budge on taxing benefits, and they say it's because another special interest, they would use that label, labor unions, are putting so much pressure on the White House and leading Democrats.
Well, I'm not sure that that's the president's concern. I think the president's concern with proposals that would eliminate the exclusion has to do with what it would do to employer-sponsored insurance. Remember, actually, this is a key thing that no one's picked up on. The House bill actually expands employer-sponsored insurance coverage by a couple million people. Part of the reason for that is it doesn't affect the tax exclusion. So one needs to be very careful in that exclusion not to undermine the coverage that most people already have.
Now, the president has been adamant. He wants this passed by the House, passed by the Senate, even if he disagrees with a little bit of this and a little bit of that. Both pass them by August so that then you can all get together and try to strike the grand compromise. There are many in Congress, as you know, who say that's an arbitrary deadline. Among them is Mike Ross. He's one of the conservative blue dog Democrats who says he wants to get this done, and he wants to get it done this year. But
whether we get it done in before August or after August, what's the hurry? We've been trying to do this since Teddy Roosevelt. What's important, I believe, is that we slow down, we get it right, and that we do it this year.
the August deadline has been in almost everything the president has said about this. But when he had the hastily arranged event on Friday, and then again in his weekly radio/YouTube address this weekend, he does not mention August. Is that deadline now off the table?
No, it's still the goal, and we
still
think,
the goal, or
think,
still the president's insistence?
We think we can make that. We're working towards that. And we have to remember, there are some who are advocating delay simply because they don't have anything to put on the table. The typical Washington bureaucratic game of, if you don't have a better alternative, just delay in the hope that that kills something, is partly what's playing out here. Not with regard to many members of Congress and senators who are actually actively participating in the debate. That's great. But there are those who are advocating delay just as a desperation move to try to kill this.
But I assume you don't include Mike Ross and the Blue Dog Democrats in that group.
He's in the constructive
So there's
group.
A constructive group in the House that says, we'd like a little more time to think this over. There's a group in the Senate, 6 senators sent the president a letter this week, Republicans and Democrats. The Republicans you would very much need to make this a bipartisan plan in the Senate. They say, Mr. President, we want to get there this year. We share your goals, but we need more time.
Well,
why not?
And the discussions are occurring. I mean, with regard to the Blue Dogs, there are discussions over the weekend. Same thing with regard to the Senate Finance Committee. Those are happening, continuing happening today, and they will be ongoing. I think there's a lot of progress, and discussions are quite active.
Let me wrap this up by a couple quick questions. The president said this was his deadline. Now you say it's his goal. That's a softening.
Well, we want to get it done by August, by the August recess, and we think we can.
And on the issue of presidential leadership, there are a lot of people who say they understand the president's strategy at the beginning, but they say this is now frayed to the point where if he wants to guarantee this gets done this year, that he needs to get his hands dirty. And if you talk to people on Capitol Hill, even close allies of this president, they're trying to question the reluctance. And many say that maybe he doesn't want his fingerprints on it now because of the experience of Bill Clinton. It became Clinton care because they put together such a detailed plan and sent it up to Congress. And when it failed, he suffered the big price for it. Is the president too timid to get involved here?
No, I don't think so. And people are reacting too much to the ebb and flow of what's happening on a day-to-day basis. Again, this hasn't happened in 50 years for a reason. It's complicated. Legislative process is working. I think people are sort of reaching judgment about who's going to win the marathon based on who's ahead at like mile 19. Not a good way of judging things. We're making a lot of progress.